Hey guys, good evening. This is a great question about how much pressure you should be feeling in your pelvic floor. So it totally depends on each person. As you progress through pregnancy, there's definitely going to be more pressure on the pelvic floor where it might feel swollen, hot, red. Those are all signs. And too, there's veins in that area, so there can be veins that cause pain and pressure there. So a couple different things that you can do if you're experiencing this. There are compression garments. Bay Maternity makes pants that take pressure off of this area. Then also doing the exercises in some of the less compromising positions. So if you feel an extra amount of pressure, some of the movements that we have where your legs are split are definitely harder on the pelvic floor, and we have them in there for a reason. But if you feel an extra amount of pressure, like you've had children before, and that there's just more going on in this area than the normal person, some of my friends just feel more pressure in this area, then I would probably do the exercises in some of the easier positions, even if they are prescribed, like the asymmetrical movements. Some of the easier positions would include doing the pelvic floor exercises on all fours, because that's taking the weight of the baby off of the pelvic floor. Otherwise, too, if you're early on in pregnancy, probably the first 20 weeks of pregnancy, a great position too, because actually gravity is helping you do this. We don't have this in the guide because it's just is a funny position, but putting your butt up in the air. So I would take pillows and then actually put my butt up in the air. So I'm trying to elevate the bottom of my pelvic floor so that gravity is helping me do the contractions. But again, it's more common later in pregnancy, but those are some modifications that I would make with the exercises. The compression garments you can ice. You can also put your hand there. The other thing would be that you're not relaxing all the way in between contractions. That is why the contraction rest period is so long in the guide. I think a lot of people believe that's a typo. It's not. It's almost harder for people to relax their pelvic floor than it is for them to contract it. So the longer rest periods just ensure. So when I have patients in the clinic, you'll see you put like an intra-abdominal vaginal like dilated thing that reads on the computer exactly what's going on. And it is crazy because people can contract, but they cannot come back down to their baseline. And of course, I'm seeing people that have dysfunctional pelvic floors. But that being said, it is really hard to relax it sometimes. So hopefully these things help. Please let me know if there's other questions or considerations that you have too.